Hello, everyone. It's great to see you all and great to be with you all again. I am Stacy Stewart, and we are at another episode of our Healthy Moms, Strong Babies webinar that we've started actually right at the beginning of the pandemic, and we've continued. I'm so pleased to be here with you all and to be the host and the moderator with some amazing panelists that I'm excited to introduce in just a second, and glad to be here at the March 9th sponsoring this activity. So we want to just set some context for what our conversation is about today, because we, as many of you all know, are just a few weeks, actually a few weeks ahead of midterm elections coming up in early November. And as we all know, depending on where you live, this is an awfully busy time politically, with campaigns on both sides of the aisle, running intense campaigns. And one of the things that we want to make sure at the March of Dimes that we're doing is continue to elevate the issues that we care most about, and making sure that any candidate running for office and all of us as advocates are really making sure that our issues around maternal and infant health are front and center for anyone running for office and for any of the political debate and policy debate that's happening. And part of the reason that we obviously feel so strongly about it is not only because it's our work and the work of many of our panelists today, but we just in the past week issued a new report, our 2022 Nowhere to Go report on maternity care deserts at the March of Dimes. We started doing this report back in 2018, around the same time, before the midterm elections in 2018. And the report was really striking this year because what it shows again is that we are moving in the wrong direction with respect to access to care for women, for moms, for pregnant people in many, many counties around the country. Maternity care deserts are known as counties that offer no obstetric care. So offer no hospital that offers obstetric services, no OBGYN, no midwife, no birthing center. And our report shows that there are 2.2 million women of childbearing age living in maternity care deserts, affecting about 150,000 babies that are born in these areas. We found that there's a 2% increase in the number of maternity care deserts from the 2020 report to this 2022 report. That's another over 1,100 counties that are now having no access to obstetric care. And it's about 36% of all counties in the country that are considered full-on maternity care deserts, and over half of all counties are either full maternity care deserts or have very limited access to care, meaning that they may have one or a few providers, but certainly not enough for the women of childbearing age living in that county. And when you combine deserts and those limited access areas over half the counties, it's about 7 million women of childbearing age. And so when we talk about this maternal health crisis that we're facing in the US, just looking at the access issue alone, it gets very clear to all of us why we have so many women and pregnant people and new moms that are facing such tremendous health challenges and health risks. Our report shows that 1 in 4 Native American babies was born in an area of no or limited access to maternity care services. 1 in 4 Native American women did not receive adequate prenatal care. 1 in 6 Black babies was born in an area with no or limited access to maternity care. And we know that Black women are significantly more likely to die as a result of pregnancy and childbirth, as are Indigenous women. We are seeing some alarming statistics around Hispanic women and how maternal mortality and morbidity statistics have declined dramatically for them during this period of the pandemic. We know that all of those women of color are going far too often without adequate prenatal care and without adequate postpartum care, which is another issue that we have to talk about. So make no mistake about it, we are facing a crisis and we have to respond. And that's what the work of the March Dimes is all about. We are launching what we call the Mamagenda, which is under the umbrella of our overall advocacy campaign, which uses the hashtag blanket change. Mamagenda is an urgent call to action for the new Congress, where we will be offering March of Dimes as recommendations based on proven solutions to shape policy going forward. And this includes legislative endorsements from not only our organization, but 150 partners, some of them on this panel today, who are all aligned around the need for systemic and substantial policy change to improve the health of moms and babies, to address social and health equity, to increase access to health programs and coverage, and to address preventable health conditions. So that's what this is all about, is how can we move into action? How can we lift our voices? How can we make sure that our voices are listened to and responded to, especially as we're heading into this very busy midterm season? So I'm happy to kick off this panel and to introduce our panelists in a great conversation. To do that, I'm just going to introduce them by name first, and then have them begin sharing some thoughts. First, I want to introduce Kim Keck, who's the President and Chief Executive Officer of Blue Cross Blue Shield Association. Kim and I have gotten to know each other very well over the past couple of years. She is an amazing advocate for maternal health outcomes. She's leveraged her position to create the kind of change that's necessary to stem the tide of maternal mortality and morbidity. She has led the charge at Blue Cross Blue Shield, the association, to declare a bold objective to address maternal mortality over the coming years, and especially dealing with the disparities across racial and class divides. And so I'm really excited to have Kim with us. Next is Eleni Sigas, who is the President and Chief Executive Officer of the Preeclampsia Foundation. Eleni is a frequent visitor to our Healthy Moms Strong Babies webinar. We're happy to see her back. Preeclampsia is a high blood pressure condition that some women get after 20 weeks of pregnancy and or after giving birth. And when it's not treated, it can cause serious health challenges. And we have many, many women who we work with at the March Dimes and who we tried to help at the March Dimes who have been affected by preeclampsia. We know that heart-related conditions in general are a leading cause of death for many women as a result of pregnancy and childbirth, and that's especially true for Black women. Eleni has used her position to be a passionate advocate for moms and babies. She's a fierce champion for the improvement of patient and provider education practices, and so we're excited to have Eleni with us today. Next is Stacy Penny, who is a Senior Project Director at NICHQ, which is the National Institute for Children's Health Quality. There, she leads the National Network of Perinatal Quality Collaboratives. A lot of us are very familiar with the Perinatal Quality Collaboratives, and at the March Times, we work very closely with them. Stacy's work is really about improving systems of care and eliminating disparities that threaten equity and the quality of healthcare for birthing people and newborns everywhere. For the past 24 years, she has been in this work. She has been in it for a long time. I met her when she was really super young, and she's still super young. So that tells you how early she got involved in this work. But she has been, she has committed her life and her career, both personally and professionally, to the health and well-being of mothers, children, and families. And she's also a former alum of the March Dimes, and we're always happy to see our alumni go on to do great things, and she continues to do that. So Stacy, thanks for joining. And not to be even more confusing, in this entire webinar that we have three Stacys, all spelled with an EY. We have yet another Stacy who was here with me at the March of Dimes. Stacy Brayboy is our Senior Vice President of Public Policy and Government Affairs. She has been an incredible leader internally and on the Hill and nationally, as an advocate to make sure that elected leaders, especially here in Washington, understand the importance of the focus on maternal and infant health. She comes to us with an amazing background in advocacy and in policy, having worked at the state level with former Governor Northam of Virginia, and in many other capacities with presidential administrations here in Washington as well. I'd also like to congratulate Stacy for recently being nominated for the Women in Government Relations Award for Advocate of the Year. And so we're always super proud of when our folks do great things. I certainly am, and I can't say enough great things about Stacy Brayboy and the leadership she's providing to us here at the March Times. So those are our panelists. We'll get going. I want to start with Kim. And Kim, I talked about this a little bit, but I'd like to ask you just to speak a little bit more about this. You assumed the role as the President and Chief Executive Officer of the Blue Cross Blue Shield Association back in January 2021. Couldn't have picked a better time to jump into that role in the middle of a pandemic. But since then, you have made it your mission to spotlight maternal health and health equity and community health. And again, you've announced some really bold goals for the Blue Cross Blue Shield Association. So talk about what you're doing at the association and how you're focused on these issues of maternal health right now and leading the association.
Absolutely. First and foremost, thank you, Stacy, for the work you lead day in and day out. Thank you for your partnership, and thanks for the opportunity to speak today. You know what? I'd say a few things, Stacey. I've learned a lot from the 2 years that I've known you, but I came to the association to really to try to do some of the things that you've described, right? Have an impact at scale. I had the fortune of running a Blue Cross Blue Shield plan in Rhode Island, and it was a phenomenal opportunity. And I felt like I could have an impact on the state of Rhode Island, which was great. One of the reasons I said yes to this opportunity almost 2 years ago now was we cover 115 million Americans in every zip code in the country. And so it was this notion of really creating what I call a better system of health, not just a better healthcare system. To use a phrase I heard you say earlier today, even, Stacey, is a better health caring system, right? A system of health caring, I should say, right? So we operate in every zip code. We know that zip code can have such an impact on a person's life. But if I take a step back and think, wow, I've learned a little bit in just a short amount of time, and I have a lot more to learn. But naively, I thought, well, of course, we're going to focus on all the things that are zip code related, because that's what we do as Blues. We do really inculcate ourselves into local communities. But as we launched a national health equity strategy 18 months ago, almost 2 years, I learned one thing that was, again, it's sort of embarrassing to share because it's so obvious, but I learned that zip code is really not the issue here. Of course, it plays a role, right? But we know that health disparities exist, racial health disparities exist, no matter where a person lives, no matter their education status, no matter their education or socioeconomic status, I should say. And to me, that was new news. It may be worse depending on where someone lives, but look, this is true, even broader than zip code. To that point, right, the other thing I learned, so first and foremost, Blue Cross Blue Shield plans are health insurers, right? And so we look at health insurance data, and racial disparities in maternal health in particular exist no matter what type of coverage a woman has. So your employer has insurance that all your employees take. Guess what? Those racial disparities exist in that population just as they do in the Medicaid population. And so again, transcends insurance coverage. And again, I feel a little embarrassed to say I didn't know at the time when we started this work that we have in the United States what you all know is the highest maternal death rate of any developed country. And it's not by a little, right? I mean, if we compare ourselves to Switzerland, we're several multiples higher. So in any case, oh, I'd say one other thing, perhaps, right? You were alluding to this a little earlier today, Stacey, too, right? Then that was all sort of 2021. And then, of course, we had the pandemic for the last couple of years. And unfortunately, we've moved a little bit in the wrong direction, of course, across so many aspects of our lives. But we know from studying our own data, the GAO put a report out yesterday as well. Disparities have worsened for all women in maternal health, and they've worsened more for Black women in particular in the last couple of years. So we have some work. I do feel first and foremost, we're holding ourselves accountable at Blue Cross Blue Shield across our 34 different companies in every zip code to say, look, we're going to hold ourselves accountable to making a difference and reducing maternal health disparities by 50% over the next 5 years. We've had some successes in that time frame, and first and foremost, I would say largely because of you, Stacey, and the March of Dimes. So partnering with your great work you're doing on implicit bias training, bringing that to tens of thousands of people today, touching tens of thousands of moms today. At Blue Cross Blue Shield companies, we have 1.7 million providers, physicians, hospitals, right? And if we can deliver care free of bias across those 1.7 million providers, we just would be proud to do that with you. One other quick thing that I would say with respect to sort of a small accomplishment in the 18 months I've been doing this, we look at a lot of data, and one of the things we've noticed is the amount of complications in childbirth that happen postpartum. We went to the federal government and influenced the federal government candidly to change the way childbirth complications are measured or will be measured, so that it's not just ending at birth, that we include the 4th trimester, as some call it, and where I think upwards of 40–45% of complications can occur. So now we feel a little bit more I don't know, optimistic, at least now that we can include women, and sometimes those women who might not otherwise have been either included or candidly believed. We think that's an important step forward. So a couple of small things that are well underway at the association, working with you and others.
Well, sometimes when we're doing this work, every little success feels really small, but in fact, they're really big. I mean, looking at the issue of extending Medicaid postpartum is a huge win. And the fact that we have well over 20 states that now that are that have taken up that option and are now have now extended Medicaid postpartum is a sign that we're moving in the right direction. Having coverage does not equate to improved health outcomes. We still have to work to get there, but that's essential. Like, that's an essential thing. And thank you so much, Kim, for all your leadership, because your bold goal setting really has inspired a whole host of different partners to jump on board. And so we're grateful for that. And we'll come back to you in just a sec. I want to turn it to Eleni. Thank you for joining, and thank you for the work of the Preeclampsia Foundation, one of our partners with Blanket Change, and one of our partners that we feel is so important because, as I mentioned, preeclampsia, other heart-related conditions, are a huge factor contributing to increased maternal mortality and morbidity, especially for women of color. I think a lot of people don't really know what preeclampsia is, though, and how it impacts people and who it impacts. So maybe you could just kind of level set for us, Eleni, on what is preeclampsia? What do we know about it? What more do we need to know about it? And why is it so important that we focus on this in the context of maternal health?
Absolutely, Stacy. And as always, thank you for that continued partnership, because I really can't think of too many conditions that squarely fall into that healthy mother, stronger babies model, because preeclampsia and all of the related, as we call them, hypertensive disorders of pregnancy really stem from a dysfunction of the organ, the placenta, that connects mom and baby. And so without having to even get all that scientific, if there is the organ that is connecting mom and baby is not operating at its best, then it's going to affect the health of both the mother and the baby. And that's why, we always say that preeclampsia is sort of a condition that affects two patients. Unfortunately, it's on the rise. I mean, we think of it as a maternal health condition, which it is, but its effect on the babies absolutely can be significant, because nutrition can be constrained, and so babies not being nourished properly. It can result in preterm deliveries, oftentimes indicated deliveries, meaning we've got to deliver because mom and or baby are not doing well. And it can result in both maternal deaths and fetal deaths. So it is not, it's not an incidental issue. It's definitely a life-threatening disorder. And like I said, I mean, it can affect, the numbers range from, let's say, 5 to 8% of all pregnancies. But when you look within certain communities or break down some of the risk factors associated with it, the prevalence could actually be much higher for some people. So it's not immaterial that we address what is causing preeclampsia and what can we do to prevent it. And unfortunately, though, what's causing it is, we're definitely closer than we were 20 years ago when I started this work, but we still don't ultimately know. And frankly, I don't think we're ever going to get that one answer. I think it's going to be different answers for different people.
Oh, that's a good point. Well, thank you. Thank you for the important work. And we'll come back to some of that in just a minute. I want to bring Stacy Penny into the conversation. And, Stacy, Stacy P, maybe I should say that.
Yeah.
would love to ask you just to start with just an outline of what is an ICHQ, what is the work that you do. And rather than focus on a particular condition, just if you could just tell us how your organization is really dedicated to improving healthcare for children, and give us a framework for how important your organization is in the context of all the work we're talking about today.
Sure. And I echo everyone's sentiment, Stacy. Thank you so much. Like all at NHQ, we so appreciate the partnership that we've had with March of Dimes over the years. So thank you again for the opportunity to be here. And yes, that's correct. We are focusing on improving healthcare for children. And when we think about improving the healthcare for children at NHQ, we're also thinking about their families and the communities where they live, right? And how they contribute to the health of those children. And that also means focusing on the factors and the systems that impact the health and well-being of mothers and pregnant people. So one of our values actually at NICHQ is equity. And when we prioritize that core value of equity, we're prioritizing health equity. And we're elevating, and what we do is we're elevating the experience of children and families in our initiatives, especially those in marginalized communities, to challenge those systemic inequities that we're seeing across the US with regards to healthcare. And NICHQ actually has been on this journey internally where we're not only examining all parts of our organization and our initiatives through an equity lens, but we're also living this value through the projects that we support, like the Federal Healthy Start and like the National Network of Perinatal Quality Collaboratives, which both are bolstering respectful, equitable, and high quality systems of maternal and infant care throughout the US. So we're really moving forward with a bold voice to ensure that we are, tackling these inequities, and we're working with families and patients, providers, and public health experts to do so.
So what I love about that is that you bring in so many different sectors of society and community to work together on a common agenda. And I think it's great. I mean, honestly, at the end of the day, there's never going to be one sector or one organization alone, including the March of Dimes, that can ever solve these things. It requires us to work together. And that's what I really appreciate about the work you're leading, Stacey, Penny. So thank you so much.
Thank you.
And we'll come back to you as well. I do want to turn to Stacey Brayboy. And I mentioned earlier, we have are launching what we call the Mamagenda, which is really a call to action to get organizations on board in a similar vein, working together to align around policy change that needs to happen in order to improve outcomes. And so, Stacey, this is an important time. We got a lot of people that are participating in the political process. They are listening to the different sort of platforms of various candidates. And this is a time when everyone gets a chance. Everyone's on an equal playing field with one vote in this country. But that one vote can make a big difference, right? When we all participate together. Tell us about what we all ought to be thinking about right now with respect to this election coming up. What can we all be doing to reach out to those that are seeking office, to let them know of our voices and our views, and just give us more tools of what we all can be doing and every individual, everyday person can be doing at this moment to make sure maternal and infant health is a priority.
Sure. First, thank you. First, Stacey, let me say thank you for your leadership and having me to be a part of this esteemed panel. I've heard some really wonderful comments, and again, happy to have you all as partners. Let me just share a little bit in terms of we've set the stage of the conversation in terms of what is the mom agenda and what we're doing here at March of Dimes, and what could everyday people who've joined us for this session, what could they actively be doing across the country? And it is in November, we all have the same voice, we all have the same power. It is about going back, making sure, one, that you're registered to vote. That's the first takeaway. Make sure that you're registered to vote. In some states all across the country, we're already seeing where there's early voting. So making sure that you take the opportunity to go and early vote. And this just isn't focused on your national elections in terms of your congressional members or your US Senate. It is looking at elections that are taking place at the federal, at the state, and the local level. We need constituents to make sure that you're going to the polls and that you're voting and that you're electing people who actually care about our issues, our values. Your vote matters. We need you to be able to go. And if you don't know where to go, let me tell you, you should go to www.nonprofitvote.org and then choose and select voting in your state and in your area. We need to elect and send people to Congress, send people to your local offices as well as your state offices that truly understand when we start talking about issues such as equity, when we start talking about healthcare, when we start focusing on maternal and infant health, when we start looking at things such as the CHIP and expanding Medicaid postpartum, and looking at postpartum and newborn health screening. I think that your voice matters. And by, as you've stated already, Stacey, it's the one day in this country where we all have the same power to impact what is going to affect each of our lives. So again, my task and my charge for you in terms of how do you get involved? Again, go to www.nonprofit voting and make sure you're registered to vote, make sure you show up to vote, and not only that, take 5 other people along with you.
That's right. And make sure you ask the people that you're voting for to consider maternal infant health as a key priority when they go to wherever they may land, if they get elected, whether it's in Congress, whether it's in a state legislature, whether it's in a governor's office, wherever they are, it will, even a mayor or city council race, these things, and or county commissioner race, these things really matter at every level, that our elected officials really understand the importance of this. So I want to talk about that a little bit more, Kim, if you would, and then others can sort of chime in on this too. I think sometimes people think that, you know, all the health things that need to change happen in the doctor's office, that it happens, you know, that if we just could get hospitals and doctors and everything to change and do things differently, then maybe we could fix all this. And I think people don't really understand that when we're talking about maternal infant health, there's so many other societal factors. You sort of began to touch on this a little bit, but that is why policy change and the policy conditions we're in right now are really insufficient to deal with the issues we're dealing. And that's why we're asking for policy change to actually improve some of those outcomes. But can you share a little bit more
Sure.
about that from your perspective, Kim?
Yeah, absolutely. And I agree. And I apologize for my little dance here. I got a little sliver of sun that my blinds aren't fixing. I think first and foremost to go back to one that you mentioned, right? The Momnibus, not the Momnibus, but the extension of postpartum coverage. I think it's 26 states now. That was part of the American Rescue Package passed earlier, right? That's huge. And it's only for 5 years though. So it's not necessarily something we have to think about today, Stacey Brayboy, to your point, but yet I wholeheartedly endorse everything you said. So at scale, the postpartum coverage is phenomenal, right? Getting access for a full year to have postpartum coverage versus 60 days is a game changer. In the meantime, though, we are doing so many things sort of at that zip code level because there is, as you said, not one single solution. So perhaps not necessarily always at scale, but we have Blue Cross Blue Shield plans across the country working with community stakeholders on things like even funding, you know, these, what we call these disparities, the root causes of some of the disparities. So food insecurity is a big one. We have many programs for high-risk pregnant women. I'd mentioned at least one in Minnesota. We literally go meet women where they are, whether it's at their home, in a community center, the local food bank, and really work with them to teach them how to acquire, prepare, and present a good, healthy meal for their family, and then even provide them counseling on what nutrition can look like. We have one pilot, it's more than a pilot, but one early program in Minnesota that's having about a 40+% improvement in food insecurity as one example. We do many others, like even funding scholarships for doulas, because to your earlier point of these deserts, it's not going to solve the desert issue, but may it be part of the solution. We hope so, particularly in places where the deserts exist. And when there's particularly not even deserts in terms of no care, but care for women that look like women who need the kind of support they need. So particularly diverse doulas, and really providing scholarships to them as sort of foundational components that may be sort of boosting the healthcare, the system of health, as I call it, but also just our lives so that we have better chances, particularly for high-risk pregnant women.
That's a great point. Eleni, did you want to chime in on policy change?
Yeah, I was just going to say kind of a slightly different angle on it, which is, as we all know, like what captures the attention of the policymakers are the dire statistics that have come out already in this call. And that's what's going to grab their attention. But what's going to grab their pen in terms of making a change are being offered some real solutions. And that's the thing that we've always tried to focus on. I mean, from the time that we launched National Preeclampsia Awareness Month, which is May, many years ago, we said from the beginning, this isn't just about raising awareness. I mean, that certainly helps, but it has to be for a purpose. There has to be some solutions and some action that can be taken. And I think that applies as we're thinking about our policymakers, is we don't want to just sort of grab their hearts. We also need to say, and here are some things that can be done about it. And a lot of what has happened in the preeclampsia space is thinking about this idea that patients can be partners with their healthcare providers. And what does that look like? I mean, that sounds like a very, warm and fuzzy feeling, like, oh yeah, we're partners with our doctors, but what are the things that have to happen for that to be in place? And for preeclampsia, it's some really simple things like making sure patients know signs and symptoms, that we are putting things like blood pressure cuffs into their hands so they can have some empowerment, some agency over their blood pressure and knowledge of their blood pressure, and be coming to their providers in a partnership kind of component. And ultimately that they are engaged in some of the policy work. I mean, I always say, like, we don't want to just be the activists that are outside with the pickets. That we want to be at the table. We want to bring the patient voice and the patient experience into the conversations where policy work is happening, where professional societies are developing protocols, where hospitals are evaluating their quality improvement initiatives. Incorporate patients in that work so that we are truly patient partners.
That's great. I think one of the things that's come up a lot is the way the system of health is structured, where in the high 90 percentile range of births, those births happen in a hospital, and only about 1 out of every 10 births in this country, which is very different from what happens in other highly industrialized countries, are any of those births attended by a midwife. And so one of the conversations that's happening in the policy space is, how do we diversify the perinatal workforce? And Stacey Penny, please talk a little bit about how you all are looking at that with the perinatal quality collaboratives. When you're talking about improving perinatal outcomes, what does it look like to have a system where there are different levels and layers of care? And what are some of the changes that would have to occur for that to be in place?
Yeah, so, and just to give folks a little foundation who may not know what a PQC is, or a perinatal quality collaborative, it's a network of teams within a state who represent multiple disciplines. So that's hospitals, that's partners, community leaders, and what Eleni said, that's patients and families, and those with lived experiences, right? So these teams are working in their state to improve measurable maternal and infant health outcomes using quality improvement practices and processes, right? And reducing care variation. So, as I was listening to Eleni and I was listening to Kim, talking about zip code and talking about patient families, it really does come down to how we understand root causes of disparities, and addressing these disparities. We really need good patient level data. And, I immediately thought of the white paper you just did, right, Kim, and talking about where is that? And so with PQCs, one of the gaps that they're seeing, a significant gap, is around data. And specifically with regards to, and you're talking about levels of care, Stacey, really using that data to really have an opportunity to stratify the data. So that's where they're seeing a gap, is hospitals may have difficulty in stratifying patient data by race, ethnicity, and language, but also collecting the data in real time. And there's a burden on that, especially when you have staff shortages that have increased and have been exacerbated by the pandemic, and hospitals and their staff are burned out, also exacerbated by the COVID pandemic. So what do you do, right? So PQCs really are really well positioned to work and partner with their hospitals to mitigate these challenges of burden by educating hospitals on how to not only interpret the data, but also provide them with the tools to stratify the data. So I'll give you an example. In Illinois, that PQC is part of their birth equity initiative. They are working and supporting 86 birthing hospitals to implement specific strategies that will really help them to review the maternal health quality data that's stratified by race, ethnicity, and Medicaid status to identify those disparities, find out where those root causes are, and address opportunities for improvement. And they're also developing a framework with these hospitals to help them stratify, again, key outcomes by race and ethnicity, like severe maternal morbidity and NTSB C-section rate. So having that real-time patient level data is so critical for all of us and all the work we're doing, but it's really critical for PQC so they can drive change, reduce disparities, and improve equity across maternal and infant health outcomes.
So I find a lot of, thank you for that, Stacey. And I find that when I talk to people about maternal and infant health, and we even talk about some of the statistics that we're talking about, and we all know very well, like the US is considered one of the most dangerous developed nations. In fact, of all highly industrialized countries, is the worst with respect to outcomes around maternal mortality and morbidity. I find everyday people are shocked by that still. They don't believe it sometimes, although it is true. And they don't really understand how that could even be, that in the United States of America, we would have some of these worst outcomes. And I think if we're talking to policymakers, it's really important to sort of hit them hard with the facts, but then also the solutions. So Stacey, I don't know, Brave Boy, if you want to start with this, and then others, I'd love for you to chime in. And by the way, we do have a question for Facebook. Stacey, before I turn to that, I'm going to take a question from Facebook if you don't mind, because I don't want to run out of time. Thank you for the question from Facebook, because we love to answer them. The question from Facebook, it says, the extended postpartum coverage include mothers with infant loss? So I don't know who would like to take that, Stacey Brayboy or Kim or Stacey Penny, or who would like to take that? I'll start if you don't mind. I'll chime in. You tell me if I'm wrong. This is Medicaid coverage, extension of Medicaid coverage postpartum for many women who may have gotten on to Medicaid coverage, to have their baby. The rules had always been that in many cases, you would get dropped from coverage 2 months after the baby is born. But what we now know is that for many cases of maternal mortality and morbidity, about 50% now of all the cases of maternal mortality are happening 1 week after the baby is born out to 1 year. So if a woman gets dropped and from Medicaid coverage 2 months after the baby is born, that means she's going without the potential to access affordable health care for an extended period of time when she may need to be seen for her own health. And so this extension of postpartum is intended to align with where we're seeing some of the worst outcomes. And so it would cover any conditions that a mother is experiencing at that time. And I will say this, and Kim, maybe you want to chime in, the fact that we see mental health issues and other behavioral health issues showing up as one of the leading causes of death, especially in that postpartum stage, then this coverage should be there for these women to make sure if they need to see a therapist or need other kinds of help, not only with their physical health, but their mental health as well, dealing with an infant loss, that kind of care and coverage is there. Kim, do you want to add to that?
Yeah, I think you said it well. The only minor add I would just supplement the broad, again, policy at scale is one of the things we're also trying to do in local markets throughout the country is even train community health workers to screen differently for that issue of postpartum coverage, because we don't really even know how many Black women suffer from postpartum coverage. I think we say 1 in 9 moms, but we suspect there's disparity in those numbers too. That's all moms from the data that we have. So yes, and one of the things we're doing is, again, sometimes it's just listening to the same questions differently for postpartum screening, asking different questions, building that trust, or even looking for different signs of depression. So not related to postpartum extension for Medicaid, but we're also trying to supplement to just ensure we capture that really challenging issue of depression postpartum.
Yeah, absolutely. Any other comments to add to that? Okay.
And Stacey, just to confirm what you and Kim both have shared, it does cover that. The quick answer is yes to the question. That
So
it is covered.
I could have just said that. We could have said How about that? But thank you. But I want to go back to this, and then we just have a few more, just a few more minutes before we have to end this, unfortunately. But if you're in the midst of a conversation with someone running for office and they're trying to convince you to vote for them, Stacey Brayboy, give us the 30-second response that we should tell someone who's looking to run for office on what would be needed to earn our vote as a maternal and infant health advocate.
Stacey, the quick answer is not really a quick answer, but I will tell you, looking at the work and some of the partners that we've worked with on the Hill, such as Congresswoman Lauren Underwood and Representative Ahmed Adams, and how they have worked extremely hard to elevate Black maternal health crisis within Congress and advancing policy solutions on maternal health and looking at the outcomes and looking at ways to end disparities. I would also point to the efforts that the White House and this administration have taken up with their White House blueprint on maternal health and how that has given maternal and infant health a national platform and public visibility that has been long overdue. What I would say to the viewers that have joined us today, I would say that ask the question, hold your legislators accountable, individuals who are running across the country, ask them, do they know about the Mom Agenda? And if they don't, I ask you to encourage them to go to March of Dimes, Mom Agenda, sign up, become an advocate, add your voice to thousands of other voices that are actually talking to people who are running for office, who are actually your elected officials. And so I would say the question you ask, and if they don't know the answer, you ask them, do they understand the importance of maternal and infant health? Then I say that you ask them the question, do they understand that there is an issue in terms of equity? Then you ask the questions, as some of the panelists have shared, looking and digging deeper into our zip codes and determining from your local, again, it ties back to your local, your state, and your federal electeds and holding them accountable. And then if you need help, reach out again to March of Dimes, pull out the information, and we will definitely arm you what you need to be asking these legislators when you go to talk to them, or people who say that they're about to run for office. It is about equity, it's about access, and it's about prevention and holding them accountable and making sure they understand that this is definitely something that we need to be paying attention to.
Well, I think you said it great. Eleni, if you're advocating for preeclampsia and focus on that, what do you want policymakers to know?
Well, it's interesting. It's not even just preeclampsia. I was just going to build on what Stacey B said, which is, a lot of times the way you have to talk to policymakers is about the pocketbook, right? And so what are the financial implications? And I think there are not that many too many issues where you can say, you know what, you're going to get a lot more bang for your buck. This is 2 for the price of 1. If you can have a healthy pregnancy experience and postpartum experience, you're getting a healthy mom and you're getting a healthy baby. And more importantly, we know that moms are such critical drivers and fuel for healthy families that this just pays exponentially. So, again, a lot of times you got to think like a policymaker, and they're going like, who's going to pay for this and why? What's my ROI? Well, the ROI is a healthy family.
That's right. That's right. Great point. And with that, we're going to bring this to a close. I can't believe this time has gone by so quickly, but I want to say thank you to all of the panelists, and thank you for joining this webinar, Mobilizing Action for Moms and Babies, launching the Mom Agenda for Blanket Change. This has been a great conversation. Again, we want to just leave you with a few thoughts that these elections matter. We at the March Times always work on a bipartisan basis. And so whether you're Republican or Democrat or independent, it doesn't matter to us. We're sort of focused on one agenda, and that is we want those that are elected to office at any level to support making sure that this is about families, to Eleni's point. It's about healthier moms and pregnant people, healthier babies, and your voice can make a difference. And so if you want to get more involved, Stacey Brayboy gave us information. Visit these websites, marchdimes.org, Blanket Change. Also, if you want more information, even at the state level, on looking at some issues around health access in your state, that Maternity Care Desert Report is really, really terrific. You can actually pull out a copy of it and show an elected official the state of wherever you live to see the issues with access to care right in your own backyard. And then lastly, I just want to say that everybody on this webinar has a fantastic website full of resources. And we want to make sure we leave those links with everyone here. Make sure you visit any of these websites, get more information. If there's still some questions that you want to learn more about, please don't hesitate to visit these sites. And again, I want to say thank you to all of our panelists for joining us today. You guys have been terrific. We're so grateful to be in partnership with you all. And we look forward to seeing you again soon and working with you over the coming months and years. So thank you so much for everything and great to see you. Thanks everybody for joining as well. Take care.
Thank you.
Thank you.